Oh, hello everyone. Welcome to this first video in a series about gestational diabetes. Look, this won't be a complete coverage of the topic. What will happen is I'll show you studies, evidence, and I'd like you to decide whether you think the studies and the evidence supports the claims that are made about the need for testing and the benefits of treatment of gestational diabetes. At the end of the day, you may decide that the evidence does support the claims, or you may decide that it doesn't. It's up to you. Remember, none of this is individual medical advice. For that, you need to see your own doctor or midwife. Well, a famous German bloke once said, "There are no facts, only interpretations." And my intention is to show you facts, but it's going to be coloured to some degree by my interpretation. I don't want you to just take the red pill and believe everything I say. You know, I wouldn't. I look like a frigging idiot, and I'm no one of consequence anyway. Look up the studies, come to your own conclusions. In later videos, we're going to look at such things as what treatment does and what it doesn't do, whether the information we're given by authorities is true or not, whether treatment can sometimes be harmful for the mother, whether it can sometimes be harmful for some babies, whether medications or diabetes drugs are value-adding in the management of gestational diabetes, and a few other things. But for this first video, we're going to set out on a search. We're going to look for the characters who form the very foundation of gestational diabetes and the whole enterprise of its detection and treatment. And these are the big, overgrown gestational diabetes babies. Some experts even call these babies feeder pace, believe it or not. If you ask a doctor or midwife, you know, what's the problem with gestational diabetes? They may say something like, well, the babies just get too big. And then they get stuck, and the poor old mum has to have cesarean section. The big baby can cause injuries to the mum, injuries to the baby itself. The baby's blood sugar levels are too low after it's born, etc. Let's have a look and see what some experts say. What do the experts say? Well, this is the US Department of Health and Human Services, and what do they say? Well, inside they say, gestational diabetes is not controlled, can cause your baby to grow very large, causing all sorts of problems. Here's some more authorities, presumably experts. This is an Australian government department. GDM, that's gestational diabetes mellitus, which is the full name for gestational diabetes. Can mean problems if it's untreated or uncontrolled. The baby's born very large with extra fat, making delivery difficult and dangerous. And the American Diabetes Association, they point out that with these big babies, because it can hurt you and your baby, it's critical to start treatment quickly. So I don't know about you, but it sounds to me like we're looking at an overgrowth emergency. Okay, so it seems to be generally agreed that it's these big overgrown babies that are the heart of the problem. But is it that big a deal? Well, it's been known for a long time that women who have diabetes already and then become pregnant have a higher rate of complications for themselves and their babies. But in recent years, it's become more and more common that women who don't have diabetes are tested during pregnancy, and if their blood glucose or sugar levels are a bit higher, they're diagnosed as gestational diabetes. And then they're treated as if they have diabetes, which of course they don't. Their sugar levels are nowhere near as high as people with pre-existing diabetes. Again, in some areas, if you ask me, and not that you are asking me, but the enthusiasm with which these non-conforming pregnancies are sought out and corrected resembles the 16th century Inquisition, in my opinion. But anyway, the result is that billions of health dollars are being spent, and more than 20 million women are being diagnosed every year in the world. It doesn't matter. You know, why make a video? Well, the thing is that once the diagnosis is made, a woman's pregnancy changes from a normal pregnancy to an abnormal medical pregnancy. And not only does it just change the way that the poor old mother feels about the pregnancy, but it leads to all sorts of downstream interventions and effects. Enough of the intro, let's begin our search. Well, where are we going to start? Well, look, we could start by looking in textbooks. And so we have pictures from a 1970s obstetrics textbook. And I think this is probably the image many of us carry around with us about what gestational diabetes babies looks like. We can look on the internet for newspaper articles and babies that are thought to be gestational diabetic, and maybe this is what they look like. But how about we actually try and find out how much bigger these babies are in real life, in the real world? What about we try and get some data? Right, so in real life, how much bigger are these leviathans of the intrauterine world, these giant gestational diabetes babies? Well, here's a study from 2016, Waters, etc., and they compared babies of mothers. Well, they compared lots of things. They compared women who, these are North American women, who wouldn't be diagnosed with gestational diabetes, compared with women who would be diagnosed, and they looked at lots of things. And these are untreated women, so this is the babies before treatment. They looked at lots of things, including the size of the babies. So here we are, birth weight. So we can see these are the non-gestational diabetes, gestational diabetes. You can see the difference in the babies. So you should look this up yourself, but it's 119 grams difference. That's huge, isn't it? Huge difference, these monsters. Let me draw your attention to the line below that. This is the body fat percentage. You can do these sums yourself. I did them. And I get about 53 grams of that 119 grams is fat. So the rest is what's called lean mass, and that includes muscle, bone, which contributes to height. So non-fat mass. So it's 53 grams fat. And remember, this is in a 3.5 kilo baby. All right, so it's 119 grams or so that changes a normal baby into a huge overgrown gestational diabetes baby. Some studies say 50 grams up to 170, 180 grams. But I couldn't get my head around how much is this? So I tried a few comparisons. So here we are. This is the extra weight. I guess this is a baby boy is carrying. This would be a baby girl. She'd be carrying this extra weight. And remember, and this would be the parents celebrating the birth, I guess. Remember that in the water study we looked at, of the 119 grams, only 53 grams or so is fat. The rest is lean mass. And lean mass includes muscles and bone. And so it may well be that these babies are taller and more muscular. And there's evidence for this in other studies. And I'll just show a couple of them here if you want to look them up yourself. To keep getting some comparisons, I got out the kitchen scales, remembering the motion of Venice. I didn't use fat or muscle, but I used some coins. And the coins on the left represent the fat component of the 119 grams, and the coins on the right, the lean mass component. And just to be fair, I went right up to the top end to 171, and again, the fat on the left and the lean mass on the right. Now, just to make this all look more scientific, let's look at a graph. This is from, I've taken a graph from an Australian study. This is the study. You can look it up. And here's the graph from inside. And along the bottom are the weights of the babies, and up the left-hand side is the percentage of babies at that weight. And you can see that the gestational diabetes babies are blue, and you can see that most babies are average, some are small number are large, but there's very little difference, is there? But you'll say that that's because these babies have been treated to stop them being huge, gigantic, overgrown gestational diabetes babies. And yeah, fair enough. So what we need to do is find out how much untreated gestational diabetes babies are and make a graph of them. But you can't find untreated babies anymore because they're all treated. So what we could do is we could find out how much difference treatment makes, how much weight it cuts off babies, and then we could add that back on and simulate the untreated size of gestational diabetes babies in the Australian graph. So let's do that. Let's find out how much difference treatment makes. This is one of the two main treatment trials of gestational diabetes from 2009, Landon, etc. And what did they find? Well, they found that in the treated group, the birth weights of the babies were that, compared to the control group were that. You can do the sums yourself, but I get 106 grams. So treatment decreased the baby's weights by 106 grams. Now, also, let's look at the fat side of things. So 427, 464. That's how much difference treatment, 3 or 4 months of treatment, insulin, medications through to the baby, etc., made a difference. Actually, I didn't do that. 430, 34. It's about 37, I think, 37 or 38 grams. You can add it up. You look this up yourself. So that's how much difference in the fat by putting these babies on diets for 4 months. So again, most of the decrease in weight is lean mass, not fat. There's another one too, sorry, I meant to look at. So this is what's called a meta-analysis or a systematic review. And what that is these authors, they gather up all the studies they can find, they put all together, and they come to an overall average conclusion. So 2017, Farah, etc. And they found treatment reduced the birth weights on average over all these studies by about 110 grams, which is pretty similar to what we were looking at with the Landon trial, wasn't it? Now, just for your interest, if you're expecting a girl, if you're expecting a boy, you could tune out for a bit or go and make a cup of tea. But if you're expecting a girl, the plot thickens. Let's have a look at this study. So this is a secondary analysis of the study we looked at before, one of the two large treatment trials. And it's the only study where the effect of treatment on girls and boys has been separated. So let's have a look what they found. Here we are. So here's treated girls and control girls, birth weight, usually the sums, but I get 29.1 grams difference. So that's the effect of treatment for girls, 3 or 4 months, insulin injections for the mum, diabetes drugs for the baby, straight through the mum into the baby, etc. 3 or 4 months, 29.1 grams. And how much is fat? This is fat and lean mass. So 429, 442, you can subtract, that's about 12.4 grams difference. So 12.4 grams for 3 or 4 months treatment, well worth it. Now just back to the coins and kitchen scales for a minute. I've represented the treatment effect in girls. So on the left is the fat component, on the right is the lean mass component. So 3 or 4 months of treatment decreases the baby girl's growth by fat on the left, lean mass on the right. What's not to like? This is well worth it, isn't it? Now let's get back to the Australian graph. And this time I've added on the 110 grams of weight that would be lost with treatment. I've added that back on to simulate the untreated state of these Australian babies. So let's have a look at this graph. Well, here's the graph again. Now this time you can see that the blue gestational diabetes babies have moved to the right because they've had their 110 grams added back on. So this simulates untreated, in their natural state, gestational diabetes babies, the blue ones. Now you can see they're just huge, aren't they, these monsters? So much bigger than normal babies. But again, what about baby girls? Remember, the best evidence we have says that treatment reduces the weights of baby girls by 30 grams. So I've taken the weights of the Australian girls and added 30 grams back onto them to simulate their untreated weights. And just for something different, let's compare untreated gestational diabetes girls to normal, in inverted commas, non-gestational diabetes boys. Here's a graph of the Australian girls with the gestational diabetes girls with the 30 grams added back on to simulate their untreated natural birth weights in the blue graph. They're being compared with the red graph, the normal non-gestational diabetes boys. Yeah, it's interesting, isn't it? A few of these normal boys are pretty big, 4,000 grams, etc. But leaving that aside, these girls, it's obvious, isn't it? It's critical, as the American Diabetes Association says, to urgently treat these girls to just strip some of that extra weight off. I mean, who needs any more tall, strong girls running around winning sporting contests, even beating the boys? Now, to finish off, I'll show you 2 pictures. These are of an average-sized, very good-looking baby girl. One picture straight after she was born, and the other picture a week later when she weighed 175 grams heavier. Now, you remember that the average gestational diabetes baby is about 119 grams heavier, maybe up to 170 grams heavier. So these two pictures represent the difference between a normal non-gestational diabetes baby and a big overgrown gestational diabetes baby. Righto, well, if it was obvious to you which of these two babies was the big overgrown gestational diabetes baby, then I'd say it's mission accomplished. We've confirmed the existence of these big overgrown babies who form the whole reason and foundation for the gestational diabetes enterprise. The next video will be gestational diabetes treatment, what it does and what it doesn't do. Leave a comment if you feel like it. Thanks for watching.